Well, hello there, everyone. Dr. Lisa Faast here with Diversify RX, and I have a wonderful guest today that we are going to be talking about provider status. Provider status is something that kind of goes in cycles around in the pharmacy industry. I think we've actually started to make some headway, of course, with the COVID pandemic. One of the tiny slivers, silver linings, if you will, is I think pharmacists have gained some recognition and some status. I think sometimes, especially with our other healthcare professionals, I think there's patients that have always appreciated pharmacists. But Brian Hose, the CEO of EpicRx, reached out to me and we wanted to have this discussion about provider status. So before we dive into that, Brian, welcome to the podcast. Thank you so much for joining me. And please introduce yourself and then tell people what Epic is. We have a lot of new people, new pharmacy owners, or there are people that just may not know who Epic is, even though you guys have been around for seemingly forever.
Yeah, we've been around for a while. Just celebrated, 30 years. So I am a independent pharmacy owner who is just recently in the last several months become CEO of Epic. We are a buying group that also has their own PSAO and has a compliance piece as well. So our footprint's around 1,100 members between the three groups. And we like to think that we do anything to help make stores have an easier go of it. I know as a single store owner, even it's challenging to keep all those balls in the air. And we like to think that we do a good job of helping stores whenever we can to kind of do some of those functions that are not necessarily things that they're used to doing. So from negotiating contracts to helping them with buying and purchasing, that kind of thing.
Yeah, so a GPO is pretty self-explanatory. Most people know what that is. You have buying contracts, help people buy better. A PSAO, most of us in the independent pharmacy know that acronym, but essentially that's the contracting side where you help people with contracting and you make it a lot easier where, people just give you information and then you go out and give it to all the others so that they have their contracts. And then another area that you guys spend a lot of effort on is lobbying and really fighting for independent pharmacy. And so I really want to focus on that area today. And, I mentioned earlier, we're talking about provider status. There's obviously lots of things that we're fighting for in independent pharmacy, whether it's against DIR fees, fighting for more transparency, there's a lot of things out there, but I think that pharmacist provider status, it's really actually quite amazing that, Medicare doesn't, recognize pharmacists yet, but yet there's so many other mid-level people that they recognize as providers. And it's certainly a fight I think we will eventually win. We haven't won it yet, but go ahead and just give us a little overview and update of, the types of lobbying that Epic really does spend its time, money, and energy doing in order to help the independent pharmacy owner.
Yeah, so until I got more involved with Epic, I've always been involved in their PAC in Maryland. So in Maryland, super involved. But as we started to branch out and look at some of these other states, I didn't realize how much we were actually doing. It's a lot of resources that we put into it. We've got a new government affairs director that's been with us about a year now that has helped us to kind of coordinate all the states. Before it was really just a hodgepodge effort of, this state is doing a great job because they have this person who's wonderful and they're plugged in and they know what's going on. So what we've realized is that we really need to do a better job of coordinating that effort, both, internally and then externally with groups like NCPA that provide a lot of support federally. But I'm with you. I cannot believe that we're not in the list of people that's a provider. When you read the list in Maryland, it was like literally everyone that you can think of that touches something healthcare related is defined as a healthcare provider except pharmacists. And so I think we've recently gotten that corrected, but then, you can be a provider all you want, but if there's no mechanism to pay you, it doesn't really matter. So it's amazing. You would think a good pandemic would help with that, but it hasn't been as easy. Even, knowing that the community knows what we do now, where they might not have before, we're still having trouble in some of these states convincing people to codify into law the things that we were doing in the pandemic. So I'm sure you've seen it as well.
Yeah, speaking of the pandemic, it's amazing that, in an emergency, we're good enough. to help out, and we, the global we of pharmacists. But regular health, it's like, oh no, we can't subject patients to you, kind of thing. And it's really kind of preposterous that that's really the way the laws are written. And when the pandemic era special resources, rules, laws goes away in May, a lot of that changes for pharmacists. A lot of that goes away. A lot of the freedom, if you will, that we've experienced is going to go away. And some states have rectified that and said, hey, we're going to go ahead and make these permanent, but certainly not at the federal level has that happened. And like you said, with payers, once it's not required to do certain things, many of those payers are going to back off very quickly from things that they might have been paying for. And, there was a statistics that something like, I don't remember the exact number, but it was like over 150 million doses and, almost the same amount of tests and things like that were all done by pharmacists and pharmacies, during the pandemic. And yet that it's like that application for that job, wasn't quite good enough, and it is a little preposterous. So I'm really excited to learn, because there's NCPA, they fight for a lot of things that are very broad. There's organizations like PUT that are fighting, for a very specific PBM angle. And so I was really excited to learn of, what it is that Epic is doing, because I don't think that there's enough organizations like yours. Like you're not a typical, like NCPA is a nonprofit, organization. They really, I always looked at NCPA as like their foundational benefit was like their legislative and their lobbying efforts. Of course, they do lots of other great things as well. But, a lot of the state associations and things like that, we kind of expect them to fight for us. And, over my, over 25-year career now, I've been repeatedly disappointed by, those state associations and the like, at least in the states that I've been in for that. So it's so great to hear of companies like yours that, you have a commercial interest in pharmacies, you do business with them. I know Epic is greatly involved with pharmacy owners and I mean, you're a pharmacy owner and you're the CEO, and I know, the board and all of that is made up of pharmacy owners, but it's really nice to see that you guys are focused on that. So in talking about pharmacy provider status or pharmacist provider status, what do you guys see as the current landscape? That's not an easy question or an easy answer.
No, it's tough.
So give us an update of what you guys are seeing.
We are totally member owned. So we are there to serve pharmacies that own us. They all have a piece of us. The landscape is challenging. I mean, you can define provider status as anything. It can be like, something as simple as MTM versus, someone doing point of care testing or prescribing contraceptives or doing smoking cessation. It's this vast array of definition. So it's really tough to say, and it really goes state by state. And in some states, we're working with a lobbyist, we're pushing bills, and I'll be honest, most of our bills, because most of what our members care about the most is the bottom line, and that's PBM reform. So most of the bills that we're spearheading and putting through are PBM reform. But we do work with state associations in some of these areas, or, some of our lobbyists are also doing this work where they're working towards expansion of pharmacy practice. And I mean, like I said, it can be lots of different things in lots of different states. And sometimes just a small victory of being able to, get an immunization bill that allows you to essentially prescribe an immunization if it's on the ACIP recommended list. I mean, that kind of thing can be provider status to pharmacies in that state because they haven't been able to do it before. What amazes me is, at least in our state, we're fighting the old, your pharmacy technicians were giving vaccinations during COVID, but they're not really qualified to do that. We're only going to allow them to do one. So they only can do immunizations for flu. That's the only one they're qualified for. It's like, you literally are doing the exact same thing hundreds of thousands of times. And, it's identical. But it's amazing that we still have those types of discussions anytime practice expansion happens in any state. So I say it's a patchwork quilt with provider status. I'm with you. I'd love to see something happen federally. I know that we keep seeing federal legislation. We keep seeing it fail. We're starting to see more of our organizations work together in a collaborative way. federally. So my hope is that that'll gain some traction. I think we're going to be stuck with this patchwork quilt bit for a while. But never give up a chance to use something like a pandemic to get some traction there. And I hope that our federal organizations are able to do that.
Yeah, and I think what COVID showed, and there was monkeypox, and it's just a matter of time before the next thing comes. So why would we not build up the pharmacist army, if you will, and keep them involved in patient care so that we're even more ready, the next one comes? Like, to me, it's just logical, but obviously politics and law doesn't always work logically. And, one of the things that I've learned, so I don't practice pharmacy anymore, but I've owned pharmacies, and I of course am inside the industry. And so where I currently live right now in Texas, I think it was 2 years ago now, Pharmacist got provider status. And I was like, that is awesome. Like, makes me want to practice again, and then come to find out, it didn't really change our scope of practice. It was really kind of funny. So when at the time, I owned a pharmacy in Texas. And so I'm talking to my pharmacist, and and he was telling me about the protocols for vaccines, and like, we need to get them renewed. I'm like, but we have provider status now. Like, didn't that change? And it's like, no, you still have to have a protocol for vaccines. Like, Texas still requires you to go out, find a doctor, have them sign your protocol, and then you're okay to do vaccines. And I was like, wow, there just seems something incongruent there. Like, you give us provider status so we can actually bill Texas Medicaid as pharmacists for a wide variety of services, but yet I can't give someone a flu shot without having a doctor say, yeah, you're good. I'm going to give you permission. And so provider status, I think, means, like you said, it means things to different people. Whereas in some states, you don't have provider status, but you have very broad scopes of practice. And so it's like, well, what's more important? Is it, a status, or is it scope of practice? And, it's this weird Venn diagram probably in there where it's like, I want it all, it's like, we want our broadest scope of practice. We've been PharmDs in this country for a really long time now. And, it's like, we're billing payers, they're paying other healthcare professionals for services. So why not pay us? My personal soapbox that I'll get on is, I think the best thing that could ever happen to pharmacy is for them to separate our reimbursement from our dispensing, just like a doctor. A doctor doesn't get paid different for an office visit, whether they give a shot or they do something else. There's like the office visit, and then there's all the other things that were given in that office visit. Same thing with a pharmacy. Like, our reimbursement for our professional services should not matter whether it's amoxicillin or it's a Hep C drug. The drug is the drug. Like, let's reimburse the drug, and then let's have the visit, the pharmacy visit, and we can then modify it in all the different ways that we need to modify it based on what that visit looked like. And that would be my dream state if I could, is just, drugs are drugs, those are going to get reimbursed, but then we're professionally reimbursed just like every other professional out there, like you mentioned. That would be my dream. But anyways, off the soapbox. And so, yeah, so we're left with this patchwork. We're left with this patchwork, not only of provider status, so it's very uncertain how pharmacists can bill for services. And there are ways that pharmacies can get contracted with medical plans, or contracted. Sometimes it's just local, depending on local plans there, or maybe they're partnered with the doctor and they can actually bill for some medical services. And on top of that, there's this patchwork of scope of practice. You mentioned prescribing birth control. Sometimes it's ordering lab tests or interpreting lab tests. Some states, the pharmacist can order the lab test, but can't interpret it, and those kinds of things. Like, there's this really interesting patchwork. Do you guys have any resources that you point people to? So if somebody's like, hey, I'm an Epic member, or maybe I'll consider becoming an Epic member, do you guys have any resources to kind of help wade through that muck of figuring out what's what in each state?
Yeah, again, I mean, it comes down to keeping things like a spreadsheet of each state as to what it is and where it goes. And as an example, in Maryland, we can do point of care testing, and you would think that would mean CLIA waive tests, which is how it is in a lot of states. But our state has limited that to very small list. So it's, oh yeah, you can be a lab, you can do point of care testing. Oh, but you can only do these 4 tests. And again, like you said, I mean, you're not qualified to interpret ones that might be more complicated, even if they're CLIA waived. So it's it's challenging. I think I'm with you in that perfect world where we've separated the product from the service, but we've been giving away the service for so long now that it's very difficult to convince people that they should pay us to do something that they know we've been doing for years just because we care about our communities. And I think that's going to be the toughest thing for us to overcome in all of these scenarios. But certainly anyone, if they want to reach out to, if they're an Epic store, they're interested in being an Epic store, want to know what we're doing in their state, want us to help them navigate it in their state, we certainly can. We have a clinical pharmacist on staff here that's positioned to help folks that want to start programs like this or want to get involved. I don't want to miss the opportunity to mention CPSN. Those folks are doing great work trying to find ways to get pharmacists paid for services that they're providing. And I think that's another avenue for provider status. It doesn't have to be a legislative fix. If there's ways that you can get paid for things that you're already doing by contracting with payers, I think they're doing a wonderful job of kind of expanding that network locally and making sure that they're maximizing the relationships that pharmacists have.
Yeah, you're dead on. You don't actually need provider status to bill. I mean, I've seen that and been a part of that in many different ways. It's up to the plan, especially now if it's a federal plan, that's where that falls under the Medicare rules. But once you switch to the private sector, it's up to a plan who they want to pay. And there are plans out there that will pay pharmacists. I know Blue Cross Blue Shield of Texas, in Texas, they will pay pharmacists for performing those duties. But then it's not as easy. Then it's a whole different world and it's a whole different language that pharmacies need to learn. And that's another tripping point, if you will, because it's, right now in our PMS softwares, you submit a claim, you get this, you may not like what you get reimbursed, but right away, the NDC, what to bill. Once you flip over to that service side, it's a whole other different language of medical billing. You don't get instant adjudication, you're sending off bills, you've got to collect copays, and it's just a whole different world. And so even if you can get paid, a lot of pharmacists don't have those ability. And that's where understanding EHR and getting connected with, I'm glad you mentioned CPSN. There's other companies out there. I know Scripted, I've talked to James over there. There's more companies out there, I'm sure, that I'm even not aware of that are working on this, that are trying to help build that gap, because there's a gap there. I don't think there's a gap in knowledge in what pharmacists know, but there's just a gap in like the workflow and the operations for how to do that I think there's great opportunities out there for people to go solve that problem. And so and they're all kind of solving it in different ways, which I think gets us to that endpoint quicker. If we're all attacking it from different ways, I think hopefully in the long run it'll make that shorter long run, and we'll be able to get there quicker. So if somebody is interested in maybe learning more about Epic, whether it's through your buying group, your PSAO, or your lobbying efforts, how do they reach out to you? What's your guys' website? What's the best way to contact either you or it is a great team over there at Epic?
Yeah, I mean, I certainly can reach out through our website, epicrx.com. They'll get you in touch, or 1-800-965-EPIC. Certainly, we can help navigate you to the right place. I really think pharmacists are a resilient, creative bunch, and we will figure this out, whether it's through the front door or through some side entrance into provider status. We're going to figure it out. It's going to continue to take time, and people being dedicated, willing to talk about it like you are, willing to make that effort in their state legislatures and on the Hill. I mean, we're going to have to work at it. So.
Yep. And my advice to anybody listening to this is don't wait on provider status. Don't wait on a payer to approve. There's, one good thing that has come from the patient side, I think, of the pandemic is there are a lot of people in our communities that are willing to pay for services that they want. And so there's many pharmacists out there, that are doing testing or doing different clinical services, and they're charging cash for it. And that's okay. You don't need provider status to do that. You don't need a payer in order to approve you. You can go out and start doing these things and just work locally with your patients. And if you provide a service they want, they're going to be willing to pay for it. So don't, let's fight the good fight. And let's not wait to win it before we actually start doing some of those things. And who knows, you might impact the right person in their life positively that has power that maybe you didn't know they had. and they might be able to help us along that way of, you know, being able to bring our services to a broader audience. So, well, thank you so much, Brian, for joining me and for all the work that you guys are doing over there. I know you've only been the CEO for a few months, and I hope you have a very successful and long tenure, and good luck. I mean, you're still a pharmacy owner. I know how that is when you're doing multiple things and you're still a pharmacy owner. So good luck over there in your pharmacy. And any last words for anybody?
Just, you know, in the words of one of my favorite pharmacy professors, it's not a sin to make money. It's okay to charge people for a service they want. And if you're going to provide that service, it's okay to charge them for it. So we've got to get used to that fact, and we'll get there.
I love that. I might steal that. So thank you so much, Brian. And I look forward to chatting you again and probably seeing you at some different trade shows.
Absolutely. Thank you.
All right. Bye-bye.